Hello. Today we will be discussing cultural competence. Working in healthcare provides us the opportunity to work with clients from all walks of life. It is important as caregivers that we are aware of the cultural difference and effective communication skills to provide the best care for our clients. This in-service will be teaching you the definition of cultural and cultural competence, benefits of clear communication, how to address healthcare for refugees and immigrants, and strategies when working with clients from different backgrounds. To be culturally competent, our agency must have a defined set of values and principles and demonstrated behaviors, attitudes, policies, and structure that enable us to work effectively cross-culturally. We incorporate all these things into our policymaking, administration, practice, and service delivery. The word culture is used because it implies the integrated pattern of human behavior that includes thoughts, communications, actions, customs, beliefs, values, and institutions of a racial, ethnic, religious, or social group. The word competence is used because it implies having the capacity to function effectively. Five essential elements contribute to an agency's ability to become more culturally competent, which include valuing diversity, having the capacity for cultural self-assessment, being conscious of the dynamics inherent when cultures interact, having institutionalized cultural knowledge, having developed adaptations to service delivery reflecting an understanding of cultural diversity. There are many improvements and positive results of communications. Some of them include reduced negligence risk, improved safety and adherence, and client satisfaction. See the slide above for more examples of clients' concerns and how you can use clear communication to resolve issues that may arise. Patients' perceptions of the quality of the healthcare they receive are highly dependent on the quality of their interactions with their healthcare provider, communication being a key interaction point throughout their experience from the waiting room to the doctor's office. The importance of effective communication between patients and healthcare providers for quality care is well recognized. Good communication between patients and healthcare providers is associated with improved patient satisfaction, better adherence to treatment recommendations, and improved health. Patients bring cultural background, beliefs, practices, and language to healthcare that require culturally competent communication to maximize the quality of care they receive. For example, patients and healthcare providers may have different ideas about the relationship between the disease, the symptoms of the disease, what is expected of proper treatment, and what is expected of them in the process. There are practical ways for healthcare professionals to act on improving their overall health communication. Active listening, responding appropriately to the client's needs and concerns, accurately assessing body language, and possessing a non-judgmental attitude are all necessary skills that healthcare professionals must possess. The importance of communication in the healthcare industry can help prevent further injuries, increase trust between the patient and the provider, and strengthen relationships with internal staff members. Research evidence indicates that there are strong positive relationships between a healthcare worker's communication skills and a client's capacity to follow through with medical recommendations, self-manage a chronic medical condition, and adopt preventive health behaviors. Studies show that the healthcare worker's ability to explain, listen, and empathize can have a profound effect on biological and functional health outcomes, as well as patient satisfaction and experience of care. Research shows that immigrant families often forego needed health care and social services because they fear interactions with public agencies. Overall, immigrants have lower rates of health insurance, use less health care, and receive lower quality of care than U.S.-born populations. Cultural beliefs regarding status and doctor-patient relationships influence what a patient considers appropriate within a healthcare encounter. Insufficient cultural competence in combination with insufficient language competence may result in an immigrant's inability to ask direct questions, express their opinions, or insist on a second opinion. Many immigrant elders say they are more comfortable with healthcare providers who spoke their native languages, precisely because they are more comfortable with the cultural norms that define such encounters in their native language and culture. Failure of healthcare providers to communicate effectively and appropriately with people with disabilities is a major barrier to delivery of quality healthcare for people with disabilities. Here are some general guidelines regarding clients with disabilities. Talk to clients with disabilities in the same way and with a normal tone of voice as you would talk with anyone else. Talk to them as adults and talk to them directly rather than to an accompanying client. Do not assume that help is needed. Always ask the client if assistance is needed. Try sitting or standing at eye level with the client and making appropriate eye contact. Guidelines regarding clients with mobility issues. Keep in mind of the client's space, including the client's wheelchair, scooter, crutches, etc. If the client is seated, sit so that you and the client are at eye level. Do not push or move a client's wheelchair, scooter, arm, etc. without asking first. Guidelines for clients with vision issues. Identify yourself when approaching a client who has low vision or blindness and introduce anyone with you. If the client uses glasses, make sure they are readily available to the client. Touch the client's arm lightly when you speak so that he or she knows that you are speaking to them. Face them directly and speak clearly. Avoid shouting. Inform the client when you are leaving the area. If the client uses a companion or services animal, never pet or otherwise distract the pet unless the owner has given permission. Guidelines for clients with hearing issues. Ask the client how they prefer to communicate and minimize any background noise or distractions. If the client uses a hearing aid, ensure that it is readily available to the client and in working order. Before you start to speak, get the attention of the client that you are addressing. Visual signs like waving and tactical signals like a light touch can be used. Do not shout or raise your voice unless you are specifically requested to do so. If you do not understand something that is said, ask the client to repeat it or to write it down. Do not pretend to understand if you do not. Cultural competence is not just one isolated aspect of healthcare. It is a crucial facet of providing excellent medical treatment. People who have chronic illnesses and frequently interact with the healthcare system have concerns with the issues of quality and satisfaction in healthcare. Efforts to improve cultural competence among healthcare professionals and organizations will contribute to improving the quality of healthcare for all consumers.